This is Robin from Sciatica Bootcamp, and today's question is, how will your doctor check if you have sciatica or not? What will your doctor do in order to confirm that you have sciatica or not? Okay guys, first off, if you visit the doctor, they will give you a few painkillers and say that basically just to toughen it out, you know, for a couple of weeks. They might send you also to a physiotherapist to give you some core stability exercises. And if the pain doesn't reduce, okay, they will send you for an x-ray. And the x-ray, an ordinary x-ray, is the cheap thing to do, okay? It doesn't cost more, it costs like almost like $100, so it doesn't cost them too much. And it's not really good to get too many x-rays, you know, because there's a hell of a lot of radiation going on down there as well, so you don't want to get too many x-rays. And the worst thing is with x-rays that it doesn't really show you. If you have a herniated disc, for example, it won't show on an ordinary x-ray. So the x-ray is like the old thing that they used in the way back, okay? They're still using it, but basically you just see if you have like a broken bone or something like that, you know. And if you have like a herniated disc or a slipped disc or something like that, you need an MRI. An MRI is the more expensive thing to get, you know. And here they will put you into a machine, and it will be in there for maybe 10 to 15 to 20 minutes, and they will actually get a very good picture of your lower back and see if your disc is, if you have a herniated disc, if you have a slipped disc, you get like much more information, like 90% more information from that. That cost is about $1,000 to get you in there, you know. So the doctor won't really want to put you through that machine the first thing they do, because it's going to cost them money, you know. So first, usually you get the ordinary x-ray, and if the pain doesn't reduce or they can't really see anything and you keep coming back more and more often to your doctor, they will send you for an MRI, okay? So I would really recommend you to try to get the MRI as quickly as possible if you have a bad case of sciatica, especially if you had it for a few years. You can have something called like a CT scan as well, but I'm not going to go into that, you know. If you have had sciatica pain for more than 6 to 8 weeks, and if you have the pain is not really getting better, it's getting worse, you should definitely put your efforts into getting an MRI on your lower back and talk to your doctor. And if you tell your doctor basically that you have your pain is just increasing more or less in your lower back and your leg, you have a constant feeling of numbness and weakness in your leg, and you're having trouble sleeping, you can't really sit down, it's affecting your life, meaning like your home life, your work life, and it's basically just becoming a really big problem for you, you know. When you've had that for a period of time, I would see it's hard for them to not say you should have an MRI, okay? So just have a chat with them, you know. Usually they're very you can have a chat with your doctor, but you need to give them the facts, because they visit quite a lot of patients during the day, you know. And if you just come in and demand to them, hey, give me an MRI, I have sciatica, you're not going to get them on your side, and that's going to be counterproductive. So please spend the time and explain it for them, you know, what kind of problems you're having, for the amount of time you've had them, and most often everything will go well and you're going to get your MRI. Okay, guys, that's today's tip. And guys, remember, just one step away from healing your back pain.